Jackie Morrison is a 15-year-old girl at Mankato West, and she plays softball. Over the last few years, Jackie realized that she began to feel joint pain and was fatigued in all facets of her daily life. She thought that this might just be normal and that she was experiencing growing pains. As for the fatigue, she assumed that she might just be tired because she is a teenager involved in many rigorous classes and 2 sports. In the beginning of her sophomore year, she began to notice that occasionally she would get tingling in her legs and her fingertips, but she thought nothing of it. She thought it might just go away. Eventually, after telling her parents enough times, they took her to their general practitioner. With these symptoms, such as tiredness and body pain being prevalent in many teens, the doctor told Jackie that she was healthy. Later on in the year, during her softball season, she was playing second base and someone slid into her leg, and she broke her medial malleolus in her ankle. She was rushed to the emergency room in the hospital with her mother, and a nurse referred her to an orthopedic specialist. When Jackie was there, they reset her ankle into the right place, all the while giving her an IV with fentanyl for the pain. The doctor also recommended her to use ibuprofen as needed once they were done. Later on, Jackie goes to an orthopedist where the orthopedist requests an x-ray of her tarsals. Jackie explains to the doctors that she is feeling tingling in her legs and she still feels weak, tired, and has joint pain. The orthopedist recommends that she goes to see the general practitioner again. When she goes back to the general practitioner recommends that she goes to get some blood work done in the lab and then go talk with the pediatric hematologist because the doctor suspected that Jackie had a blood disorder. When Jackie went to the pediatric hematologist was able to confirm from the lab results that Jackie had sickle cell disease and told the family that it was so hard to diagnose her with sickle cell because of her young age. The doctor recommended a new treatment for the disease for young patients that involved bone marrow transplantation that actually cured the disease. Although the procedure was risky, the parents and Jackie decided that the potential benefits were worth it and went through with the procedure. It was successful, and after the procedure, Jackie had to stay home doing nothing, no activity, for a week over her summer break while she was recovering from the surgery.
Sickle cell is a genetic disease in which the body fails to produce enough healthy red blood cells to carry adequate amounts of oxygen throughout the body. In sickle cell, the red blood cells become sticky and form into a crescent moon shape. These sticky cells can sometimes stick together, blocking the blood flow and decreasing oxygen delivery, causing episodes of pain called crises. These crises can be brought about by change in altitude and temperature, stress, dehydration, and illness. Some symptoms of anemia are fatigue, dizziness, shortness of breath, pale skin, tingling in the extremities, and other stuff. When crises occur, blood flow is stopped, causing blood to no longer flow to the brain. When blood stops flowing to the brain, a stroke happens. 24% of people with sickle cell have a stroke by the age of 45. Sickle cell disease can injure blood vessels in the eye. The most common site of damage is the retina, where blood vessels can overgrow, get blocked, or bleed. Gallstones are a common problem in sickle cell disease. Sickle cell disease causes the kidneys to have trouble making the urine as concentrated as it should be. This may lead to a need to urinate often and to have a bedwetting issue or uncontrolled urination during the nighttime. Other problems are blood in the urine, kidney disease, and protein loss in the urine. When red blood cells undergo hemolysis, they release hemoglobin. Hemoglobin gets broken down into a substance called bilirubin. Bilirubin can form stones that get stuck in the gallbladder. There is only one known cure for sickle cell, and it is bone marrow and blood transplants, and only a handful of people are able to receive. For the majority of those diagnosed with sickle cell, pain meds are prescribed.
People who have sickle cell disease who have received frequent blood transfusions may develop liver damage from iron overload, a type of liver damage that can occur when sickled red cells block blood vessels in the liver. This blockage prevents enough oxygen from reaching the liver tissue. Sickling in the bones of the hip and shoulder joints, knees, and ankles can decrease oxygen flow and result in severe damage. This damage is a condition called avascular or aseptic necrosis, which is the death of bone tissue. The sickle cells stick together and block the flow of oxygen in the vessels in the lungs. It resembles pneumonia, including a violent cough, fever, and pain.
People with sickle cell disease are more likely to get infections because the damaged cells eventually clog the spleen. This results in splenic sequestration or pooling, which can cause a sudden drop in hemoglobin.